Welcome to the While You Were Working podcast, presented by Rogue Marketing. When you're responsible for revenue, it's hard to look up from the work, but while you're doing your day job, the market shifts. While You Were Working is where we turn today's trends into tomorrow's strategies. Welcome to While You Were Working.
Welcome to While You Were Working, the podcast for revenue accountable business leaders wanting to stay ahead of the curve. I'm Chip Rosales, managing partner of Rogue Marketing. Now, Rogue is a strategic marketing agency that helps clients defend their marketing spend. We're business builders who carry a marketing toolbox. And I'm so glad that you're joining us. You know, it's hard to keep up with the trends and the insights that are shaping business when you're busy driving growth. That's why we regularly sit down with revenue accountable leaders, unpacking their experience and sharing actionable insights. The world moves fast while you're working, and today's guest is at the forefront of growing revenue in an extremely targeted, highly competitive space of healthcare. I'm joined today by Rhonda Quintana. She is the revenue officer at Ceresti Health, and she has assembled a team of compassionate professionals that assist families of patients dealing with Alzheimer's and other dementias. I'm excited to talk with you because I think you're sitting at the forefront of a growing business in one of the most highly competitive and unfortunately growing areas of this dementia work. So Rhonda, how would you describe what Ceresti Health does?
Well, Ceresti Health is a dementia care provider with a differentiated model of care. I would call it a next generation model of care for dementia. And we really do this by enabling caregivers to have the education, the skills, and the confidence to be able to detect an early change in condition. And we do this through kind of a high-tech and high-touch approach with a very dynamic and personalized program that really covers the full spectrum of dementia while patients are still aging at home. And so we are really proud of the fact that we have built this program where we can do this at scale nationally. And we're really one of the only companies that has proven results in terms of reducing hospitalizations and significantly reducing medical costs.
It's dementia is such a personal thing right now. So it's got to be highly rewarding to be able to sit in the chair as the revenue officer. I'm interested in hearing how you got to that revenue chair and then maybe the purpose and the value that you find in doing that work.
Man, it is really rare when I talk to somebody on a day-to-day basis that isn't touched by dementia in some way, right? Either their grandparents had dementia or, they're currently caring for their parents, and maybe we call them sandwich caregivers, where they're caring for an aging parent and they're also raising their kids at the same time. So the mission is clear, right? There is so much suffering inside. And if you've never taken care of a loved one or seen somebody take care of a loved one with dementia, it is devastating for families. And so really there was an opportunity for me to come to this company and I think feel the work in a very different way than I have in my healthcare growth career, if you will. And so I get to hear every day about the impact that we're making really at the patient level and at the caregiver level in terms of how transformational this is for them. In terms of, we hear things like, I've learned more from your program in 3 days than I have in potentially 3 years in working with, my healthcare system or my provider. So, and it's not because the provider doesn't want to provide some of that support and education. They're just not well equipped to do that. And so I'm really excited about the fact that I've been invited to be a part of this journey. I have my own personal experiences around that. I watched my parents take care of my grandparents that had Alzheimer's, and it was a devastating journey. So the fact that I have an opportunity to impact positively the outcome of some of these families and make that journey, that difficult journey, a little bit easier. It's very easy to get up every day and go to work. CMMI actually launched a program last year called GUIDE. GUIDE stands for Guiding an Improved Dementia Experience. And because Ceresti has done this work in dementia care for over a decade in Medicare Advantage, we were able to really take a look at this new program coming out in CMMI and applying for that, getting approved to be a participant this year, and really being able to translate a lot of this really important work and into traditional Medicare populations versus just Medicare Advantage. And so all of that's very exciting for us in terms of us being able to expand our lens into not only Medicare Advantage, but really taking care of the entire Medicare population at large.
How do companies in your space need to measure return on investment with their sales, their marketing, their operations programs? How do people need to be thinking about that in your space?
I think I mentioned earlier that, I think that we can't do the things that we've always done, specifically in healthcare sales. I think we have to really get outside of the ways that we've tried to message. I think that these teams, or at least the way that I'm thinking about it, is we have to generate things like what we're doing right now is generating thought leadership, content that people really care about. We need to educate folks on really what the problems are. And there's lots of ways that you can solve a problem. It's just about, is that way the way that your buyer or your audience really is going to lean into, I think, the work that you're doing. I'm a big believer also in making it like tying in emotion. I think that so many times we talk about in healthcare, we talk about super important around cost savings, super important about improving quality, super important around, patient satisfaction and provider satisfaction. I will tell you, if you can't tell stories, like for example, in my space, if you can't tell stories that resonate with people at an emotional level. And so, for example, if I told you this story about, let me put this problem kind of in perspective for you. Imagine it's your mother and she's starting to forget things. She's starting to forget her keys. She's forgetting her doctor's appointments. And all of a sudden you hear this word, dementia. And guess what? Now you're a caregiver, right?
Yeah. And you have a face for it.
You didn't sign up for it. You didn't train for it, but you have the job now, right? And so if you can't reach people in a way that really brings it home for them, I think storytelling is incredibly important. And I'm not sure that we do enough around that. I was recently at an event where there was a physician on a panel discussion, and he kind of described those things. He described those things as in, we talk a lot about the cost savings. We talk a lot about the data. We talk a lot about the mechanics of, what we're trying to do. But families are suffering. I mean, he brought it home like, wow. I mean, it really took me back in my seat to a place where I was like, that's the kind of storytelling that I want to do, right? And so when I think that you can reach people at that level where they go like this in their seat, I think that's the kind of ROI, marketing, storytelling, something that people are really going to remember. And it's not just one way. I think you have to find multiple ways of reaching your audiences, and it's the sky's the limit.
I think you're right. I had it in my mind. I might even ask you, healthcare is one of those places where the acquisition costs to find new targets and to be able to reach out to the people that you want to talk to is astronomically high. But what you just said there really is a way for breaking through, right? How do you deal with that? How do you deal with these acquisition costs? You've got to target them. You've got to grow with them. They take time to mature, and the sales cycles are, you don't hear a podcast and necessarily do something the next day. It takes a while. I was going to ask you about that, but even as I was just listening to you, it sounds like the storytelling, the thought leadership, how do you arrest somebody's attention and take them off of their, put them back on their heels just a little bit, like you just said. Those are probably the answers. Did I leave anything out? Is there anything, to me, I feel like you might have answered the question, but anything else I'm missing on how you're dealing with acquisition costs and how you're growing these companies that have long sales cycles?
I can tell you that we are leaning in heavily to automation. We're leaning heavily into really trying to optimize and get the most out of our systems. We're trying to get creative with some different ways to produce content that is snackable, that's digestible, that's in the format that we all want to see and listen to right now, right? And try to also balance that with a level of information and credibility and, again, thought leadership that people want to lean into. They want to hear more. And so I think that for us, really, it's about finding those different and interesting ways. I mean, it sounds really silly, but even as simple as, and one of my personal, goals is to really every day try to learn something new in my technical environment. And I've had the opportunity to talk to different leaders about even differences between, using ChatGPT and using Grok 3 and using Claude and all these different ways that kind of surface information differently. Somebody just recently, this is probably not new for a lot of the folks on your podcast, but people explaining to me why they like to use Perplexity, which is really helping if you do a lot of research, it's designed to do certain things. And so for me, I think our challenge and opportunity is for us to really understand how to make all of these new tools. It's moving at the speed of light, by the way. How do you use all these tools in the right way and invest in the right way to make all of that create an environment where 1 + 1 = 10?
Well, congratulations on that experimentation. I'm so excited to hear that. That warms my heart. My marketing heart is just warmed when I hear that people are playing around with experimenting and doing all those things. I'd also say that on those tools, if you're not using the latest versions, you're really far behind too. So if you're on that free Chat GPT version, then you're missing out on what's really possible with all the latest versions. If I say a number, they'll have changed it by the time this airs. So whatever the latest version is, get on that for sure. I really appreciate you just, again, educating us and taking time out of your day to spend with us. I'm going to make sure that everybody has all of your socials and how to get in touch with you. Also that website link for the guide program, so that if they've got a loved one who is in the midst of that, definitely want them to know how to get that. What's one thing you make sure to do every day as a leader?
I try to learn one new thing every day. Right now, it's around artificial intelligence and tools, but that is one intention that I have every day, is to spend 15 minutes learning something new in my technical environment.
Yeah, 15 minutes is like dog years. You can do so much. Great. What about a metric that you think matters the most?
Man, there's so many. Probably the one that companies and investors and leaders care about is conversion and really close rates. So that's kind of a basic one though, right? Are you looking for something that's a little bit kind of off the cuff or?
No, quick takes, great. So, but like just even from conversion perspective, like what is it about the conversion? Are you seeing something that indicates it's going to be a conversion? Is there any sort of indicator?
Here's what's really interesting. We are developing a proprietary kind of go-to-market. We're calling it, well, internally, it's a scoring mechanism, right? It's for me to score and prioritize the types of opportunities where we should be spending the most of our time. And so when I think about conversion rates, and I'm trying to obviously have the best conversion rate that I can in terms of, let's say a close rate, for example, the way I'm going to do that is if I know what deals I should be working on. So we've actually created kind of this priority scoring system in order for our teams to get better at understanding where should we spend the most time and where the opportunities are going to yield the best fastest way for us to get to a yes.
Yeah, and I can see the passion and excitement for that. So that's really, really great. All right, last one. What's a book, a podcast, or a resource that you swear by?
Ooh, my favorite book is a book called The Power of Moments by Chip Heath, I think.
Oh, he's one of my favorites, but I don't know that book.
The Power of Moments. I am a big believer in creating moments that really impact folks. And this book talks a lot about how to do that. And I like it because it's not exclusively business focused. It's not exclusively personal focused. It's really things that you can use in any aspect of your life. And it will really make you pause and think about the little things that you can do to make a lasting impact on folks. So, absolute favorite book.
Well, thanks for adding a new one to my list. That's awesome. I really appreciate you being here. Thanks for spending time with us.
It's a pleasure. Thank you so much.
Today's conversation touched on something deeply personal, helping families navigate the most difficult healthcare decisions of their lives. And while the mission is noble, the economics, they're challenging. Healthcare has some of the highest customer acquisition costs of any sector, which makes a recent infographic I saw on quality data especially relevant. The piece highlights that bad data isn't just inefficient, it's expensive. In fact, poor data quality increases acquisition costs by as much as 60%. That's a tough pill to swallow, no matter what industry you serve. Here are a few of the standout stats from the piece. Contact data decays 70% every year. Businesses could be losing nearly $13 million a year to bad data. Sales teams increase sales by 23x with good data. And here's the kicker. Only 35% of companies are very confident in their own data quality. It's not just about waste. It's about trust. When your data is wrong, you're targeting the wrong people, sending the wrong message, and showing up at the wrong time. That's not just bad marketing. That's lost impact. A link to this article is posted in the show notes, and we'd also invite you to follow us on social media. You can search Rogue Marketing on Facebook and X, or Rogue Marketing Agency on LinkedIn. We're regularly sharing insights and articles that you might have missed, while you were working. See you next time.